management of out-of-hospital cardiac arrest in women, the SDEC Paris study. Professor Timmis.
Well, thanks very much, Barbara. So I'm just going to comment on this interesting study from Paris on sudden cardiac death and its management in the greater Paris area. But I just want to show you a couple of introductory slides first. And these are data from here in East London that we put together a while ago now. And what it shows, and what you need to know, is that death before reaching hospital occurs in 25% of all patients with myocardial infarction. So it's that period between the onset of symptoms and getting to hospital, which is actually the period of greatest risk. And as I say, it accounts for a lot of the deaths. And what kills people during that period is this, the heart going into a chaotic rhythm called ventricular fibrillation, which is illustrated on the slide here. But the important point to notice is that is the shape of the curve here for the first episode of VF after the onset of chest pain. And you can see there's an exponential decline in the risk of VF or ventricular fibrillation over the first 6 hours. It's that first 6-hour period that claims so many lives. And here's another study we did in our unit looking at mortality among patients who arrived at hospital after out-of-hospital arrest, having received some form of resuscitation so that they had recovered their spontaneous circulation. And without going into detail here, what the slide shows is the factors that predict death after hospital admission in these patients. And the one I want to draw your attention to is the third one down, successful reperfusion. And that reduces the risk of death by 70%. What is successful reperfusion? It means that patients who've survived an out-of-hospital cardiac arrest, who go straight to the catheter laboratory to have the blocked artery identified and reopened by an angioplasty procedure. If that's done successfully and promptly, it reduces the risk of death by 70% in this high-risk group. And that's why it's a European guideline Class 1 recommendation that patients who have had an out-of-hospital cardiac arrest, get to hospital, should go straight to the cath lab, well, that's the cardiac catheterization laboratory, to have the artery open. So let's look now at the SDEC study from Paris that was presented at this meeting. And what they were, this was a good study for a number of reasons. One is that the population they were interested in was all patients who had had an out-of-hospital cardiac arrest in the Paris area over a period of time, regardless of whether or not they survived. And there were 11,420 such patients in this study, all of whom had an out-of-hospital cardiac arrest. And you can see that 38% of these were women and 62% were men. And you can further see that only 18% of women and 26% of men survived to hospital admission. This is a lethal complication. And depressingly, for the investigators, of those who survived to hospital admission, only about half, that's 40% and 60%, women and men, went to the cath lab to have the blocked artery dealt with. And of that less than half, only 26% actually had a procedure to open the artery, 26% of women, 36% of men. So there are two key points that this study tell us. First of all, high-risk condition. Secondly, guidelines are not being followed. These patients are not being taken straight to the cath lab. And thirdly, and most relevant for this session, women are disadvantaged compared with men, both in terms of survival to hospital admission, to getting an angiogram, and if they get an angiogram, to having a procedure to reopen the blocked artery. So in summary, in patients with myocardial infarction, the risk of lethal ventricular arrhythmias is greatest immediately after the onset of symptoms and declines exponentially. Death before reaching hospital occurs in 25% of all patients with heart attack, constituting 70% of the total attributable mortality. ESC guidelines call for immediate angiography with a view to reopening the artery by what's called percutaneous intervention. And the French study shows that fewer women than men first survive out of hospital cardiac arrest, and if they survive, receive guideline-recommended treatment. So I've put on this slide some discussion points to guide any questions. Why do only 40% of women and 60% of men get an angiogram when they get to hospital? You know, that's not what the guidelines tell us. And why does a greater proportion of women compared with men die from out-of-hospital cardiac arrest? Is it because they delay seeking help, and it's known that women put up with their symptoms a little better than men and don't rush to dial 999? Is it because the severity of infarction is greater in women? Is it because they have more comorbidities? That's things like hypertension, diabetes. And finally, why do fewer women compared with men receive guideline-recommended angiography? Is it because they're for some reason not fit to go to the cath lab in terms of frailty? I don't think so. Or is it because of some inherent bias in the way that we treat women? And finally, and a little provocatively, why are less than 20% of cardiologists in the UK women? Okay, any questions?
Thank you very much. Now we are open to questions after each of the presentations.